Hi, I'm Ajwa. Please subscribe to Nurse Kelvin YouTube channel and don't forget to like and share. Thank you. Bye bye.
Unyami ya uye nyamiye, matise wa sem nu yo jao. Unyami ya ubo sure, matise wa sem no man bebre. Unyami ya ubo asase, se wa sem nu yo jatia. Yentem bejimie, fisemani da wasem so. Hi lovely people, welcome back to the Kevin TV. On this episode, I want us to talk about the different type of nurses we have in Ghana. A lot of our SHS graduates and the young ones out there want to or have the dream of becoming nurses, but a lot of them don't know about the path available in this nursing field or this amazing profession known as nursing. That's the reason why today this video is for you and anyone who wants to learn about nursing. I want to take you through the different type of nurses we have and the role each of these nurses plays in the field of nursing. So that's the reason why we are here today, because many of you or many of these SHS graduates, and I say a lot of people who want to continue with their nursing, a lot of them don't know where they need to maybe apply to or go to. So because of the things that maybe they are limited to information or they are limited to a lot of things, like they don't know about the kind of nurses or the kind of nursing field that we have in Ghana or we have in the field of nursing. So that's the reason why this video is for you. Please like, comment, share, and also subscribe. Please subscribe for us. Subscribe for us so that we can also get to our destination and then we become a bigger family. So guys, let's dive into it. So the first thing that we have is we have registered nurses. We have registered nurses. These registered nurses, they are the nurses, they are the common ones that we know. They are the backbone of nursing. I'm gonna the backbone of nursing. And these people, they are the ones who do the patient assessment. They are going to administer the medication, and also they are going to coordinate the care. So we have the registered nurses. We have the registered nurses. Mostly we call them the RN. So that one is what their field they also are the registered nurses. Their field is there. Then we have what the licenses or the practical licenses nurses, which most of them know in other countries. We call them what the enrolled nurse. So I'm a picture you can watch it. You call them what the enrolled nurse. What they do is they also provide basic nursing care like checking of vital signs. They also care for wounds and assisting with daily activities. And they do all these things under the supervision of the RN. One would make sure meaning that the RN is higher than those in the enrolled nurse. So the enrolled nurse they do the basic stuff like the vital signs, checking the wound care, and also assisting in the daily activity in the ward, and under the supervision of the RN people. So when I make sure they do that under the supervision of the RN. Then we have the nursing or the nurses midwives. So we have midwives. So the midwives, what they do is they care for pregnant women until the for them to care for our crown also. So what they do is they specialize in woman production health, in pregnancy, labor, and childbirth. So they care for the mother during the time and mostly when our mothers are pregnant, but they are going for review they are going to check all these things all these things they are the job of for the nursing midwives. Then they also make sure should in case somebody want to go and do family planning, family planning and all those they are the ones who are going to educate the patient, make sure you understand all the family planning methods available so that you can choose from the one you want. So that's the work of the midwives. Then we have the nurse anesthetics. So when we talk of the nurse anesthetics, we say when a patient is being scheduled for surgery, and as a patient when surgery, mostly say the no surgical room we have nurses for one mostly my surgery and I say I want me panning and I'm here then we die. So like the omuna here then it was happening sort as before answer and as I almost do before answer surgery procedure and I then I started and they will make sure say they will monitor the patient through the surgical procedure in that to say the surgery will be done and sana so before answer the patient will be transported to the ward and I say will be transported to the recovery center and say independent so then all this one is the job of what of the nurse anesthetics sort as so they were going to make sure say the surgical procedures in patients in the one in Bruno and making sure say we monitor patient in the well-being then is a work of what of the nurse anesthetics. Then we have what the pediatric nurses. So when we talk of the pediatric nurses, they are the nurses that care for child or care for young ones. So this in Gofo, they care for the infants. They will become adults. So those small people, they are being cared by these nurses known as the pediatric nurses. So the pediatric nurses, you need to make sure you have patients who are you have the heart for children before you venture say you want to become a pediatric nurse, because like you can't diagnose a kid say or can't say if I told me how and I say you are going to look out for the symptoms. The answer will be the only thing the kid can do answer will be the one who said and make sure you know whatever you are doing before you apply to become a pediatric nurse. Then we have the community health nurses. So these community health nurses, what they do is they are the people who will go to the communities to give education about health. They will make sure they will prevent diseases and promote health in our communities areas. So it will get to time most at times we will feel then nurse if we say about polio, which is a time now COVID by we saw some nurses came to our houses talking to us about how we need to use the protective equipment to prevent ourselves from getting the coronavirus. So and they are those people now who were giving the vaccines, the vaccination process are being done by these public health nurses. So they give education, they make sure they promote health in communities, in remote areas, and in the country. So that's the work of a community health nurse. Then we have the critical care or the ICU nurses. So when we talk of the critical care or the ICU nurses, now they are the nurses that works. They work at the intensive care unit. So when we talk of the intensive care unit, it's a unit where they send people with a very critical or serious condition. Those people don't know say the patient is maybe going to recover and all those. So when your condition is very serious, that will be where they will take you to the ICU. So we have the nurses who are in the ICU. Then we have emergency nurses who also work at the emergency. They are being trained for emergency cases only. So should in case you are applying to become a nurse, you know where to go. Whether you want to become midwife, you want to become RN, you want to become an enrolled nurse, you want to become a nurse anesthetics, or an ICU nurse. Then we have the nurse educator. The nurse educator, they are the people in our various nursing trainings, the universities who are teaching us to also become future nurses. So we call them the nurses educator. So you can also learn to become a nursing educator. That one too is also another profession that you can do to become a nurse. Then the flight nurse, your nurse who are also specialized to become nurses in flight. They will play more. We have flight nurse. Then we have ambulance nurses. Wow. People just see those people like it's just normal thing. We say, but Charlie, it's a very serious thing. You need to learn. They learn a lot of things before you can become an ambulance nurse. So yes. Then we have the forensic nurses. So when we talk of forensic nurses, they provide care to victims of what? Assault, microphobia, those people no they provide the care to this. We have the mental health nurses. So the mental health nurses, what they do is that they are the nurses who care for people with what? Mentally challenged conditions. And also they also serve as counselors to people who have what? Mental condition or mental stresses and all those they are going to make sure that they will care for them, they will help them and give them medication and all those stuff. That's the work of what? Of mental health nurses. We have what? The mental health nurses. So guys, these are the different type of nurses we have, and all the work that or the role that each of them plays. So should in case you are an SHS student or you are a general public member who want to maybe know more about nursing or who want to go in depth about nursing, Charlie, know where you want to go. Know where you want to go. So in case you want to become an RN, you want to become an enrolled nurse or a practical nurse, or you want to become a midwife or all those, please know where you are going to. And like, don't just see say, oh, there mental health. Everybody has the role he or she is playing. So here we have the role that we are all playing in the field of nursing. So know where you want to go to and know where you want to apply to. Thank you guys for watching. Please keep on watching Kevin TV. Subscribe and turn on the post notifications so that anytime I drop video on this channel, you'll be the first to watch. I love you. Bye bye.